Welcome back. Welcome back forpay.org. This is Consumers Dr. Bengala. Thank you for joining us. Let's look into health insurance coverage, folks. A lot of you have never gone into details, see how to obtain a health insurance coverage. It all depends on where you stand financially, folks. If you're if you're working full time, you have to get to employer. If you're getting part time, sometimes you're eligible to get the health coverage by yourself or by the employer. But you're self-employed, and depending on the status of your financial status, you need to explore all the avenues how to get the best healthcare coverage. First of all, if you're healthy, you have no health related issues. That's very important, folks. It's if you're healthy, you can get a high deductible health insurance. If you have an illness where you need constant, regular visits to your doctor, you need to get a low deductible health insurance premium. That's number one. That's very critical, basing on your health status. And number two, where you stand financially. If you're independent, you have some savings, you have some accounts in the brokerage, and you have put money aside over the years, and you have taken an early retirement, depending on where you stand financially. So if you're, that's number two, financially where you stand and what your income level is. You need to look at what your income level is. If you are making over 55,000 or under 55,000 or 30,000, whatever the income level is. The reason I'm asking you is your premiums and your health saving contributions are deductible based on your income status. And number three, if you are trying to get a health insurance coverage, you can go to the open marketplace healthcare.gov and shop around, see what is the best option for you. If you, as I said, you can take $7,000 deductible or you can take 3,000 basing on your health status. Once you decide that, then your premiums have to be based on your health insurance coverage is basically once you decide to get a health insurance coverage yourself and your family, then basing on that, what you have to do is on the healthcare.gov, if you're making over 55,000, then you can your over 55,000, your premiums are based on that. And suppose your income is less than 55, it is 20% less. If it's less than 40, 20% less. If it's less than 30, actually you may be eligible with almost 60 to 70% of the premium, folks, basing on your. And if you're a resident of California, Covered California also gives you the same ca.gov, cahealthcare.gov, basically gives you the same codes basing on your income status. Once you're eligible for that, then you can contribute for your health insurance premium. When it comes to the health savings, this is where it stands. If you're over 55,000, you're not eligible for deduction. That's crazy. And if you're under 40 to 55, again 20%, almost 80% is deductible. And if you're between 40 and 55, again, it's around 60% deductible. And if you're under 30, it's almost like 80% deductible. Your health savings premium, folks. A lot of folks, what they're doing is if they're healthy and they have to get a health insurance, what they do instead of paying into the deductible health insurance premium, they just contribute on a regular basis $300 a month into the health savings account. It's not deductible, but you contribute anyway, so you can contribute $3,000 or $300 or $3,600 a year. And the same thing for your family, $600 and roughly around $7,200 a year. And you don't pay any taxes anyway because you have no income. But people who are self-employed, they can do that. They need to watch out based on their health status. If they're healthy, they can take the chance. I'm not sure what you want, because this is where I really get discouraged when I advise people to get health insurance coverage. When you have no income, and there has to be, when you have a low income, I'm sure the people have some income, but if they have a low income, there should be a way to get health insurance coverage for these folks. This is what we need to focus on. People who are in the low income bracket, we should give them a certificate of guaranteed coverage, and he can take the certificate, he can go to any private insurance carrier and get the coverage. And at the same time, they should be incentivized to put money aside into the health savings accounts for their future health care. This is what I've been trying to convey the message, but for some reason or the other, because the healthcare it's so complicated, it makes it so difficult for average folks. It's hard to understand where they are, and sometimes a lot of people just don't even bother. That's how I end up in emergency room with no insurance, no nothing. Folks, there are a lot of issues we need to look into when it comes to your health. First, stay healthy. That's number one. I want you guys to take charge on your health care. Thank you guys for listening. I want to make it short because it makes it easy for you guys to watch it, short clips. And once you understand that, then I can get into the detail. So thank you for listening. If you like the channel, hit the like button, subscribe, share, and even contribute for forpay.org. It's a nonprofit. Folks, this channel is for you guys so that you can empower yourself on healthcare. Thanks again, and God bless.